First thing we do, we come back to the anal verge, and then we do big wheel down, and you do a sort of 90-degree turn, clockwise torque, just to view the rectum in retroflexion, and then I always go 180 degrees just to make sure we're not missing anything on the other side of the scope. We then decompress the rectum so you lose luminal view, and then my foot goes on the pedal for the water jet, and essentially views are a little bit more difficult in this sort of situation, particularly if the bowel prep's a little bit murky, and so what you just have to do is it just takes a little bit of practice to get your eye in. Very important, not putting in gas at the same time. There are some people who turn off the carbon dioxide during water assisted insertion, and I personally think that's not necessary. I think I've got enough self-control to avoid putting carbon dioxide in. So we're just on to the sigmoid now, and you do a lot of clockwise torque with water insertion, and we're just going over the sigmoid. Usually this is the uncomfortable bit because we're now going into an alpha loop, and you're sucking all the way. That's really important. So you're putting water in continuously. My foot's still on the pedal, and I'm just putting water in as we go. So this lady's we're actually going into more of an end loop now. So we're going to get to the splenic any second now, and then we should be able to straighten. And usually at this point I'll turn onto the back just to make things a little bit easier, and I'm straightening the scope, so I always suck when I straighten. Now, whether you carry on using water is pretty much up to you, because of course we've done all the hard work now. In terms of insertion, generally if you're using a scope with a stiffener, I put it on now, or if you're using a pentax scope, you try and keep clockwise torque on just to keep your the sort of proximal shaft, which is in the sigmoid, straight. So I'm in the transverse now. I'm not putting either water or air in at this point, and we're just sucking just to keep the colon sort of relaxed and corrugated over the scope, coming up to the hepatic flexure now. So I just put some carbon dioxide in. That's the first time we've needed to use gas. And patients in the supine position at the moment, if I need to, and I have a very low threshold for going onto the left here just to assist sort of intubation of the ascending. Using a bit of tip control now, so I'm using big wheel to go up. We can see, hopefully that's the cecum in the distance there, submerge, and again all I'm doing is sucking. And I think that's cecum there. Great. Thank you very much.